Abdominal contouring in men is different than it is in women because there are different things that have influenced why there's a problem there. With women, it's almost always related to the changes that happen with pregnancy. Obviously, that's not going to happen with a guy. With men, usually it's a problem of excessive fatty tissue and some sagging of the skin, and it depends on where that skin excess is. Now, most men tend to put a little more weight on the inside of their abdomen, around the intestines, and some on the outside as well, but more around the intestines than women do. That area is something that we can't address with abdominal contouring. It's something that only diet and exercise can help. The portion of the fatty tissue that's on the outside of the abdominal wall, we can deal with. With that, liposuction is a good answer if the skin tone in the area is good. And almost always in men, the upper skin tone is pretty good. In that case, we vacuum away the extra fatty tissue with liposuction, and the skin can contract to match that new contour. The lower part of the abdomen, though, sometimes can be a little bit more tricky in that that skin can be redundant, and if we take away the fatty tissue, that skin kind of hangs. So in that case, on a man, sometimes we'll consider doing what's called a mini tummy tuck, where we take away skin and fat on the lower part with an incision, and then vacuum away the fatty tissue from the upper portion to get a smoother contour. That minimizes the amount of incision we have to make, but maximizes our result. The other situation is when a man's had a major weight loss, and in that situation, usually we actually have to revert to a full tummy tuck because some of the same things that would happen with the pregnancy have happened with that weight gain, where the muscles of the abdominal wall separate, the skin is beyond its ability to contract again, and there's just too much skin. And so in that situation, a full tummy tuck is necessary that tightens the muscles, that takes away the skin, that relocates the belly button, and makes everything smooth and nice. It basically depends on what your situation is, and it's a good idea to get evaluated by a board-certified plastic surgeon to find out what's the right procedure for you.